The topic of today's video is diabetes, causes, symptoms and effects on health. Diabetes mellitus is a chronic condition in which blood glucose levels remain elevated. The two most common types are type 1 diabetes, where the body does not produce insulin. Type 2 diabetes is when blood sugar level rises due to insulin resistance or insufficient insulin production. Persistently high blood sugar causes inflammation of blood vessels, damage to the inner lining of arteries, called the endothelium, increased oxidative stress, abnormal cholesterol metabolism. This damage makes arteries stiff and narrow. It also promotes the formation of fatty plaques inside arteries, a condition known as atherosclerosis. When this occurs in the heart arteries, it leads to coronary artery disease. Coronary artery disease, or CAD, occurs when the coronary arteries that supply blood to the heart become narrowed or blocked. In diabetic patient disease, plaques form earlier, disease progresses faster, blockages are more diffuse and complex. Multiple vessels are often involved. Diabetes also increases blood clotting tendency, raising the risk of heart attack. Another dangerous aspect is silent ischemia. Because diabetes damages nerves, some patients may not feel typical chest pain during a heart attack. This means heart disease can progress silently until a major event occurs. Diabetes affects nearly every organ. Kidneys, leading to diabetic nephropathy. Eyes, causing diabetic retinopathy and vision loss. Nerves, leading to neuropathy. Brain, increasing stroke risk. Peripheral arteries, causing poor circulation and foot ulcers. But cardiovascular disease remains the leading cause of death in diabetic patients. Common symptoms of diabetes. Here are the common symptoms of diabetes, both type 1 and type 2. Frequent urination, polyuria. You may feel the need to urinate more often than usual, especially at night. Excessive thirst, polydipsia. Because the body loses more fluids through urination, you feel very thirsty. Increased hunger, polyphagia. Even after eating, you may still feel hungry because your body cannot properly use glucose for energy. Unexplained weight loss, more common in type 1 diabetes. The body starts breaking down fat and muscle for energy. Blurred vision, high glucose levels can affect the lenses of the eyes. Slow healing of wounds, cuts and infections take longer to heal. Frequent infections, such as skin infections, urinary tract infections, or fungal infections. Tingling or numbness in hands and feet. More common in long-standing type 2 diabetes, nerve damage, nausea and vomiting, fruity smelling breath. Prevention and protection. These are the key steps to keep your sugar level in control. Strict blood sugar control, healthy diet with low refined sugars, regular physical activity, weight management, blood pressure control, cholesterol management, regular cardiac screening. Treatment options. Treatment depends on the type. For type 1, insulin injections are necessary for life. For type 2, lifestyle modification is key. Healthy diet, regular exercise, weight control, oral medications. Sometimes insulin is required. Regular blood sugar monitoring is very important. If uncontrolled, diabetes can lead to heart disease, kidney failure, vision loss, nerve damage, stroke. That's why proper management is essential. Diabetes is serious, but it is manageable with the right care and lifestyle changes. If you found this video helpful, please like, share, and subscribe for more health education content. Stay healthy, stay informed. Thank you for watching.